According to Harrop et al., perinatal mental ill health is a significant risk factor for maternal mortality. The World Health Organization state that there are various effects on maternal and infant health and well-being that are associated with ill mental health.
I have been living in the UK for 12 years. I like it here. I have 4 children, all girls. My husband works as a taxi driver, always working. I went to see my nurse on Monday. She asked me lots of questions. My husband was there, and I didn't like to talk about it. I cry a lot at night. I don't feel sad, but I feel very tired. My husband said it's because of the baby. My nurse keeps saying the word depressed. I have never heard of this before. Sometimes I want to run away, but I can't. I want to stay in bed, and I want to go to sleep.
There are many barriers to women not accessing perinatal mental health services, including fear their baby will be removed, stigmatising views, lack of confidence from midwives for support, and normalising symptoms of mental ill health due to pregnancy and hormone changes. South Asian women may face extra barriers as well as these, including cultural norms. Research by Tiwari, focusing on South Asian immigrant women, found that this group face constant pressures to fulfil gendered roles in a patriarchal nature. Women now seem to be homemakers and depend on their families socially, financially and legally, in turn creating feelings of isolation. Isolation may lead to feelings of low self-esteem and depression, resulting in women not accessing or connecting to services in their local area. Language barriers and insensitivity to culture is also a problem for these women. Smith found minority women found significant problems in requesting translators, and midwives lack the time to sort these issues. Women also found services to be culturally insensitive by seeing male healthcare providers. Research by Memon et al. Concluded that due to a number of barriers that South Asian women face, considerable mental health literacy and practical support should be offered. There is also misinterpretation on mental health problems. It is thought that mental health brings fear and shame onto the community, and the word depression does not exist in the Urdu language. Research by Time to Change suggests another barrier to care is fear and secrecy. This qualitative study includes quotes from South Asian women discussing mental health, ultimately suggesting that it is still a taboo subject. This can create difficulties in diagnosing and treating mental health in pregnant South Asian women, as they may try to conceal their feelings. Stigma related to mental health is seen in all cultures. However, these women deal with double stigma from both society and their community. By looking at the model of the social determinants for health, it can be suggested that healthcare providers should be targeting social and community networks to address these barriers.
Other services include IAPT GPs, health visitors, children's centres, peer support and online resources. But do women access the support? Statistics from MIDA's 2018 stated that 71% of women access peer support. However, it is widely known that South Asian women do not access support services and therefore cannot be justified for this population. In May 2018, NHS England announced 35 sites currently underserved by community services that would see an expansion in perinatal provision as part of a plan to have access for mothers in all parts of the country by April 2019. Bate et al. 2018. The one-year round report stated that by 2020-21, specialist perinatal mental health services must be available to meet the needs of women in all areas. This requires closing the gap in 85% of localities, which are estimated to not have sufficient services to meet NHS 2014 guidelines. However, the British Medical Association 2018 found that NHS England's actual spend on mental health was 12.5% of their clinical budget in 2015-16 and only 12.7% in 2016-17. Despite the new funding commitments and some geographical variation, there appears to be no obvious uplift in spending or clarity around how the committed funding is being spent. It seems that more funding for perinatal mental health for clinical commissioning groups should result in further improvements in provision by 2020-21. According to the Implementing the 5-Year Forward View for Mental Health, perinatal mental health will receive significant investments by 2021. This raises the concern that the extra investment will not be used entirely for the expanding perinatal provision and improving frontline services. It will therefore be important to closely monitor the progress of the expansion for perinatal provision throughout this period.
The RCM report that the UK are currently 3,500 midwives short. It is identified by Jones that midwives have both a legal and ethical duty of care, and this can be affected by a shortage of staff. Previously, a midwife may have held a deontological stance on their principles in the care being provided for each individual. However, now a more utilitarian approach is being adopted, making the care provided do little else but benefit the majority. These shortages also leave midwives feeling under pressure, and in turn, levels of care are dropping, leading to the care that is being provided to be questioned. And in this case, when it comes to recognising and identifying ill mental health in South Asian women.
So I'm just going to run through some questions. The appointment's an hour, but we should be able to just whiz through it really quickly, okay? So during the last month, have you often been bothered by feeling down, depressed or hopeless?
No, not really.
Okay, and during the last month, have you often been bothered by having little interest or pleasure in doing things?
Not really.
Okay, perfect. So we're just going to move on to talk about your screening tests.
My husband doesn't understand, so neither will this woman. I can't tell her how I really feel. She'll just tell me there's nothing wrong and stop wasting her time. Or maybe it'll be worse than that. Maybe she'll think I'm a bad mum. Does that mean my baby could get taken away? No. It's definitely best that I stay quiet.
Despite the adverse effects mental illness can have on women, perinatal mental health remains largely unrecognised and untreated. This is partly due to inconsistent documentation of mental health assessment and a lack of monitoring of symptoms. NICE recommends that midwives consider using the Hooley questions during the initial booking appointment and into the postnatal period. This brief screening tool has been introduced across England and Wales to identify women at risk of experiencing perinatal mental health problems. Darwin et al. Criticised the tool for low sensitivity and suggest that there is a lack of guidance on how assessment scores translate into eligibility for interventions. They also highlight the lack of clear referral pathways to determine which professionals would undertake further assessment. A survey by the Pandas Foundation found of 419 midwives and health visitors, 72% reported insufficient perinatal mental health training. A qualitative study by Noonan et al. Found that midwives felt they lacked knowledge and confidence in supporting women with mental health problems, particularly across cultures. This impacted midwives' engagement with the process of identification, screening and referral. Likewise, EDGE found that midwives felt pressured to prioritise physical problems over mental health, and that time constraints resulted in midwives only acting on cases of severe mental health issues. Midwives are in a unique position to address mental health with women during pregnancy. Our proposal is the Perinatal Mental Health Discussion Wheel, which is based on 7 key risk factors. The objective is to utilise the questions as prompts, incorporating them into conversation rather than via restrictive checklist format. This tool encourages open questions, enabling midwives to build rapport with women in a safe environment. It breaks down the common barriers experienced by South Asian women as it promotes a holistic approach in identifying mental health issues. Addressing mental health in a conversational manner is likely to reduce social stigma that checklists and other screening processes arguably exacerbate.
So Miriam, pregnancy can be a really challenging time for many women, both physically and emotionally. So I just want to ask you, how are you feeling about the pregnancy?
She's asking me how I feel. Maybe I can tell her that I've been struggling.
This could be a cost-effective and sustainable tool. However, it is unrealistic that the tool alone will benefit women without further culturally sensitive perinatal mental health training. With a greater understanding of the signs, symptoms and risk factors associated with mental health, midwives will be in a stronger position to challenge the assumptions prevalent in South Asian communities. Consequently, midwives will be better equipped to formulate a woman-centred plan of care that meets the needs of each woman and her family.